MDS is a very specific disease in respect that prognosis is really dependent on certain characteristics as far as cytogenetics is concerned, as far as the blood counts are concerned, and also the blasts. And we have very good prognostic markers or prognostic scoring systems that we use, like the IPS or the revised IPS, the IPSS-R, that are very valuable for the clinic. But the questions that we usually ask ourselves is, how can we use mutations for prognosis? And I think here the answer is challenging, because obviously mutations are not part of the IPSS or the IPSS-R. However, we do know that they can give us some additional information. And what I mean is that we do know that patients that have a number of mutations, so 5 or 6 mutations, they're the ones that have a very poor prognosis, and that is probably independent of the IPSS-R or the IPSS. And we've also learned some additional information about TP53 mutations. Here we know that it's probably not related to a single mutation in TP53, but a multi-hit mutation in TP53 that has an adverse prognosis. And I think we need to keep that in mind when we look at patients and when we look at the IPSS or IPSS-R. And if the patient has a TP53 mutation, we need to keep that in mind, what kind of mutation that is. And obviously, mutations can also help us in getting more targetable approaches. But in summary, I would say we do have a good prognostic scoring system that is based on clinical parameters as well as cytogenetics, and it's very well validated. But I think to give a more sophisticated prognostic view for a patient, we should also look at the molecular profile.